Don't let anybody tell you that you have to suffer and you have to live this life which is limited by Hashimoto's. Do not settle for a life that you do not enjoy.
If you want to live like you matter, ditch the pills, look great, and feel freaking amazing, you're in the right place. I'm Dr. Wendy Trudeau.
And I'm Dr. Ed Levitan. Welcome to the 5 Journeys podcast,
where we empower you to live a vibrant and healthy life by optimizing your structural, chemical, emotional, social, and spiritual lives.
Hang on to your hats.
Welcome to another episode of 5 Journeys podcast, Live Like You Matter.
We're privileged to be joined by Dr. Anshul Gupta. He's a best-selling author, speaker, researcher, and world expert on Hashimoto's disease. He's board certified in family medicine with advanced certification in functional medicine, peptide therapy, and also a fellowship trained in integrative medicine. Through his innovative approach towards Hashimoto's disease, he has helped thousands of patients to reverse their unresolved symptoms and live their life to the fullest. Dr. Gupta, welcome.
Thank you so much for having me on the show. It's a privilege to be here.
We're delighted. So I think we have to start at the beginning, right? What is Hashimoto's?
Yeah, wonderful. That's a good question, I think, because a lot of people think Hashimoto's and hypothyroidism or low thyroid issues are exactly the same issues, but I want to let the audience know that they are not. So Hashimoto's is an autoimmune condition where your body is actually producing antibodies, which is destroying the thyroid gland. And that actually ultimately leads to hypothyroidism. So Hashimoto's is the one reason that people get hypothyroid, but they're not exactly the same. Now, in the current scenario, actually, Hashimoto's is the number one reason of hypothyroidism. Initially, when actually people got diagnosed with hypothyroidism, the number one reason a decade ago was iodine deficiency. But in the current scenario, because we have iodine kind of fortification in our salt and everything else, that reason is almost obsolete. We don't see iodine deficiency anymore. So the number one reason is actually Hashimoto's now these days. So one thing, a lot of people have this question and maybe a lot of people do not understand is, they ask me this question, well, what does actually thyroid do? I understand that, I have a thyroid that produces thyroid hormone, but what does it actually do? So thyroid, I call is a metabolic hormone. Basically, this is responsible for taking care of the metabolic needs of the body, which means basically energy production. Our body is responsible for energy production. If there is no energy, we will not be able to function. So thyroid plays a key role in actually helping the mitochondria and other body to function in the appropriate manner, especially taking care of the metabolic needs and the energy needs. So that's the main function of the thyroid, but the thyroid receptors are present all over our body. Each and every organ of our body has thyroid hormone receptors. So that means thyroid hormone binds to that receptors and is responsible for optimal function of that organ system. So basically, if you do not have thyroid hormone, literally we will not be able to live. So that's the key and that's the importance of thyroid hormone.
Yep, no, that's great. I want to back up and go to the basics of what is some of the symptoms of Hashimoto's and how do people know that they might have Hashimoto's and what is hypothyroidism? Let's get first to the basics and then we can talk about how to help it.
Salt.
Right, absolutely, yes. So the most common symptoms of people that present with Hashimoto's is that they have issues with weight gain or inability to lose weight. Then they feel tired or fatigued. Then they have gut-related problems like constipation or IBS. Then they have mood changes like feeling depressed or anxious. Then infertility actually is a big issue that a lot of females are seeing because of Hashimoto's. Then we have other issues, like skin problems or hair problems with hair falling or hair thinning. Again, a major complaint that a lot of females have with Hashimoto's also. And then brain fog, that is another symptom that, I see a lot of females coming to me that they're presenting with brain fog or ADHD-like symptoms. So I think those are all list of symptoms that happen with Hashimoto's. Now, these are very, very common or symptoms with hypothyroidism also. So in hypothyroidism, basically what happens is that your thyroid gland is supposed to produce this thyroid hormone. And in hypothyroidism, your thyroid gland cannot keep up with the demand of the body of thyroid hormone. So the low thyroid hormone is responsible for giving us all these symptoms.
your description of hypothyroidism and Hashimoto is kind of like every human walking or every female I see with weight gain, brain fog, fatigue, issues getting pregnant, hair loss. I mean, it's kind of like everyone.
Yeah. Well, that's where I was going to go. Is
everywhere.
How do we distinguish that versus an irritable bowel that has a gluten sensitivity? What are the testings, or how do we distinguish Hashimoto's from all the other things we do in functional medicine?
Exactly. Again, a very good question. The question is really good because we do not do appropriate testing for thyroid in general. Conventional medicine, we are all taught up just to check one lab, which is the TSH, which only tells us whether, our body is not able to keep up with the thyroid hormone production or not. But, if you actually look for Hashimoto's, then we have to do much more detailed thyroid testing, which includes the T3 hormone, the T4 hormone, and along with that, antibody levels. So there are two antibody levels, which are the thyroid peroxidase and as well as the thyroglobulin antibodies that needs to be checked. So these are the basic tests. Whoever has any of these symptoms that we mentioned, which you literally said almost every second person or every second female that you see has these symptoms. But these tests, the good part is that are available in all the labs and they're covered by a majority of their insurance. So everybody should get these testing done so that they can know they have Hashimoto's or not. If these tests are negative, then then obviously they have to look for other reasons, for their symptoms.
So obviously Hashimoto's is going to be treated differently than hypothyroidism, which does not have an autoimmune component. So first off, it sounds like you're testing on everyone. So you're going to know up front whether it's straight up hypothyroidism, Hashimoto's, or something else. So how are you treating them, and is there a difference?
There is a big difference, and that's where again the conventional medicine, is not very helpful for, regular folks. Because in conventional medicine, there is no differentiating factor between hypothyroidism and Hashimoto's. The treatment is the same, just giving everybody levothyroxine, that's the only treatment they have. But in functional medicine, we have actually differentiating factors. Hypothyroidism, the main problem is low thyroid hormone and they need thyroid hormone supplementation. But in Hashimoto's, the underlying problem is actually totally different. It is this autoimmune component, these antibodies which are destroying the thyroid gland. So in functional medicine, we actually make protocols to help lower these antibody levels so that the destruction of the thyroid is, stopped. And we can sometimes actually able to recover the thyroid so that the body starts functioning the thyroid hormone which is needed by it.
So let's pause for a second. You're basically saying you have found a way to tell the body to be kind to itself and stop destroying itself, right?
Right.
So can you have normal thyroid function then, but still have an autoimmune disease? And how do you approach those people?
Very important question, and that's the reason the complete testing is very important. Because again, if you only check the TSH, then you only are checking for that amount of destruction that the thyroid needs to stop producing the thyroid hormone. But I see so many folks that their thyroid hormone levels are normal, but their antibody levels have always been high. And nobody has done anything about it. So if we actually, work on these folks, on a timely fashion, we can stop the destruction of the thyroid gland. And these people actually can be safeguarded from going to the hypothyroid side.
So what do you do for them?
Good. So that's where my 3-step process comes.
You make it sound so easy.
It's only 3 steps. 5 minutes, right?
3 major steps, right?
Yeah. Just 3 steps and you'll be all good. I promise. So basically these 3 steps, first we are actually looking at what is causing the trigger or what is causing the destruction of the thyroid gland. Because most people think, well, one day I just got autoimmune disease. Well, not really. Your body doesn't think one day that, okay, well, I'm just going to start destroying myself. That never happens. There has to be a reason. And that's where, we functional medicine doctors are trained to kind of find the reason why, why is body destroying. So that's the very first step of finding the right triggers of those folks. So I've divided these triggers into the 5 different categories. So these, triggers are, first category is food sensitivities. Food is medicine, but food can also harm your thyroid or can lead to destruction of the thyroid gland. So food sensitivity is number 1. The second is nutritional deficiencies. Our body needs certain vitamins and minerals to function properly. A lot of times, because of a poor lifestyle or even the environment we are living in, our body gets low on certain vitamins and minerals, which triggers Hashimoto's. The third, the underlying problem is toxins. Our body time and again, in our environment, is being pounded with more and more new toxins every day, more chemicals in an environment. So that again leads to the trigger of Hashimoto's. The fourth is stress or trauma. We are living in a stressful world. Sometimes work is stressful, sometimes it can be relationships or divorce or even pregnancy.
That never happens. Relationships
are never
great.
stressful.
I know, right? So even pregnancy, can be so stressful for for female bodies. And we see that trigger of Hashimoto's that happens after the delivery, because that's a big change in female's body.
I think people think of it like, well, it was a joyful event. And my response is, but it's still a stressor. Even if it's not stressful, it was a stressor. And people forget that those major life changes, even when joyful, can be extremely, they can tax the body. That's all.
Exactly. And that's what I always whenever I'm working with a client with Hashimoto's, I say, well, why don't you go back to the time where actually you were diagnosed with Hashimoto's and look like a year before that, what kind of was happening in your life. And almost like 70 to 80% of people will go back and they will say, oh yeah, this happened or that was a stressful moment in my life. So the stress and trauma is such a big trigger that most of us basically ignore it. But that's a very, very important reason that people do get Hashimoto's. So that's my fourth category. Well, the fifth category, which is the infections. Okay. So, we deal with a lot of infections like viruses, Epstein-Barr virus infection, or infectious mononucleosis. Then there are a lot of parasites can trigger Hashimoto's. Then obviously Lyme disease and other things can also do that. So these are the big 5 categories, which are responsible for triggering the Hashimoto's. That's the very first step of identifying what all triggers are present, what all the root causes of the patient is there. And then actually the second step is, start fixing the problem. The second step is, where I developed this mitothyroid diet. So this mitothyroid diet, so interestingly, as you guys might know, there are so many different diets in the market, like AIP diet, paleo diet, SIBO diet and all those things. But interestingly, nobody has made a very, very specific diet for the thyroid gland, right? We can use the AIP diet for thyroid patients. Yes, we can use a paleo diet, but the thyroid gland has specific requirements, right? As we already know about it. So in this mitothyroid diet, the very first step that we do is what we call as elimination of things, which we kind of consider are the triggers for more majority of the folks. This is similar to the elimination process where we are removing foods. So that's the very first step. So certain foods which I feel are trigger for majority of the Hashimoto's patients, are the gluten, dairy, soy, corn, sugar, processed food, processed meats. So all of those foods, that we know are triggers for majority of the autoimmune diseases are also triggers for Hashimoto. So that's the very first step that you do, but that can easily be done by anybody who has Hashimoto's.
Food's a huge trigger for people. And so you're going to get people from all walks of life. They're going to either be the people who already said to you, yeah, I've been doing AIP for years. And then you say, oh, well, you can eat more than you're eating. Or you have the people who are like, what's gluten-free? So what are you recommending to people who have not done any elimination of foods? Is there a system that you say, start with this, move to this, or do you just wipe the slate clean? How do you recommend they approach that?
So if the people are totally naive to what the healthy diet is, then I generally start them first with introducing the concept of what is the quality of food? Because a lot of people come to see me and they feel that they have been doing a healthier version of the diet, which is basically they said, well, I'm following a diet which is 1,000 calories or less, but I'm still not able to lose weight. But on those diets, whether they're eating an ice cream or whether they're eating blueberries is exactly the same. It's just the calories that matters. So I help them understand it's not about the calories, it's about the quality of the food. Ice cream and blueberries are not the same.
They go well together, though.
No heckling the guests, please.
No, I'm just thinking out loud.
Yes. So you're talking about nutrient density and the quality and phytonutrients, not just calories.
Exactly. So that's the first thing I introduce to them. Okay, we'll help them understand that, make better choices. Once they're ready for it, then I actually introduce the concept of actually removing foods which are totally unhealthy or a trigger. So that's where I introduce the concept of gluten, why gluten is bad and how they can be gluten-free, and then the dairy-free. So those are the things that, definitely I start eliminating first before I go into the other detailed things for those folks.
So you start with the food, and then what happens?
So food, then definitely we work actually on some supplements. So, there are certain supplements which could be helpful to supporting both thyroid as well as the mitochondria. So that's what we start off with. So some of the supplements in that situations will be zinc is a very important supplement for thyroid. Selenium is an important supplement for thyroid. Magnesium is good for both thyroid as well as mitochondria. Then vitamin D, like a lot of people, most of the folks are low in vitamin D. So that's another supplement that we introduce.
D or B? D like David or B like buzzing bee?
So both, but definitely D. D for David, the first go, and then B for, like a boy in the second step. Okay. Because, the problem is that how many supplements can you introduce into a person? I'm not a fan of introducing like 30 supplements, to my clients in one go. Generally start with like a few supplements and then, add a few more, as we go along, depending on the needs. So that is what we do.
Do you use things that are blended, or are you doing one zinc and one B12 and one vitamin D3? How are you approaching that?
Yeah, no. I definitely use the blends. I like the blends so much, because these all work synergistically. Like these are not standalone vitamins. What I call is that, our body is a symphony. It is made with so many instruments which are kind of, going on together. So we cannot kind of differentiate, like one or the other. So we have to use these blends of all these supplements together so that the whole system starts working again. So definitely I'm a big fan of blends. That's what I use.
No, that's great.
Are you doing the toxins eval at the outset for people? Because it seems like there's sort of levels and categories, right? So a portion of people are going to respond to just diet. A portion of people need diet and nutrient deficiency treated. And then you're left with the toxic group, right? So do you start your toxins evaluation at the beginning, or do you wait to see who's not a responder and then make them do the testing? Where do you put that?
Right. So actually, I do that in a two-step fashion. So everybody who have Hashimoto's will have some level of toxins. So what I feel is that everybody with Hashimoto should start optimizing their natural detox channels in their body. So what I feel is that there are 5 detox channels, in our body which are naturally present. One is, our sweat glands, like through sweating, we eliminate the toxins which go out of the body. So that's where the saunas get, their properties. The second way is, through kidneys. So again, most of the people do not drink enough water. So again, I tell them, push them to drink enough water, good quality water. So that's the easy way to doing it, right? And then the third is through your gut, right? So having regular bowel movements, everybody, must have at least one, if they can have more, that is great. So then the fourth channel that the detoxifies, is through your liver. So again, helping them to pick better food choices which can support their liver. So that's another thing that, definitely we work with. The fifth is the lymphatic channels, that's where the dry brushing comes into place, which again, people can do easily. So these are free things, people don't have to spend a lot of money, but they can definitely be very, very helpful in optimizing the detox channels. So this again, when people get started with us, I always tell people, along with the diet, if you can start doing these things, this will be nice. And then, after that, even if after doing these things, people are not getting better, that's where we actually go with full evaluation of the detoxification and then kind of figuring out what toxins they have and then making a specific protocol for it.
So how long does it take to actually recover? Like, let's say you all do all this stuff and you get back on track. You take your supplements, you do your saunas, you eat the foods, you eat a good diet that's right for your
and
body.
You're perfect, right? You're always perfect.
Perfect. It has to be perfect.
You're always perfect.
You can't deviate one bit. How long does it take? What's the range? Obviously, everybody's different. What's the range? And of 100 people that you see, how many actually people do you see recover? It's never 100%.
Now, that's an important question. And that's what, I ask a lot of my clients. Okay, what does that mean by recovery or by reversing, right? So for me, the recovery process starts with when people start feeling better, right? Because the quality of life is the most important thing with thyroid patients. So that's what I say is that, a lot of times, if your quality of life is back, you're feeling good, that's one aspect of recovery. The second aspect of recovery is obviously looking at the antibody levels. So improvement in the antibody levels is the second aspect that we work with our clients, and getting them better. Now, again, getting the antibody levels back to normal or back to zero is never the goal. Because once people have Hashimoto's, there will be certain levels of antibodies which will be present. But if we can get them, because people that come to see me, their antibody levels are 2,000 or 3,000 range, while they should be less than 30, right? So if we can bring them in a sustainable range of, let's say 100 or 50 or something, that's a win-win for me. From 2000 to 100, that's great, right? So that's the second thing, definitely improvement in antibodies we're looking at.
How long does that take?
So between 4 to 6 months, between when we repeat the levels, obviously within a couple of months, their symptoms start improving. That's the first thing. Within 4 to 6 months, the antibody level starts getting better. And then within like 6 months to 1 year is that the maximum benefit people will see, that the antibody levels will reach a trough level, like whether they're back to normal or whether they are actually in the range which is acceptable. And the third thing we actually see is that, sometimes reduction of the medication dosage, or actually even people are able to get off the medicine dosage. So that again takes between 6 months to 1 year. Because I'm a little bit more gentle with my clients getting off the medicine. I'm not the one that, okay, well, day one, okay, you stop all medicines. I generally don't do that.
What kind of compliance do you have with, because food is such a trigger for people. So what are you considering compliant, and what's the excursion rate at which people can still expect to see improvement, but not be perfect? Because humanity isn't perfect.
And that's what we believe in. Like whenever clients come to see me, they want to do everything in a perfect sense. I always tell them there is nothing like perfection. This is life. Life is going to throw, things at you. You will not be able to do things perfectly in odd sense. If you try to be perfect, then actually you're creating another problem of stress, and stress will actually make things worse. So don't do that. So let's say, like, try to do your level best. If you are 70 to 80% compliant with the diet, that's awesome. That is more than, that will give you the benefit. But, like what I tell also my clients is that just listen to your body. There will be specific food, which as soon as you eat, your body will tell you that the worst food, like that you can consume. So if that is the signal that you're getting from the body, then try to be staying away from it for like as much as you can, which happens mostly with like gluten or dairy. People will say, okay, well, I gave gluten for 4 weeks, but, like I had like a pizza or something, like when I was like on a birthday party or somewhere else. And the very next day, like I actually paid for it. So I said, well, so see, like you listen to your body, and if your body is telling you gluten is not for you, then maybe it's not for you. But some people come to see me, well, I accidentally consumed some sugar. Okay, well, I did not feel the worst thing. I said, that's okay. Like maybe you don't have to use a processed sugar. Maybe, like you need to have a healthier version of the sugar. That is the situation. So that is why I say 70 to 80% the diet should be followed, and then listen to your body. And then the food which doesn't agree with you, definitely try to stay away from it as much as you can.
Got it.
That makes sense.
What are the most common reasons people will relapse? We might have just kind of covered that, but are there other things that throw people off and have them get a setback around their Hashimoto's?
Stress. Like whenever a client starts with me, I said, one free advice that you are going to get from me is that, like start doing some stress reduction exercise daily basis, either meditation or deep breathing or whatever you like. Start doing it right now. And everybody, like not everybody I will say, but a lot of people actually do not listen to that advice and always ignore that
It was
piece.
Free. They
Yes.
don't value it.
I know.
Right, you start charging for that advice.
Charge
and then-
more for that.
Exactly, right?
Do you have a favorite meditation app or a website or anything else that you commonly refer people to?
There are actually a couple of them. So, I actually follow a meditation practice of my own. It's called heartfulness. So like how we have mindfulness, it's called heartfulness. So they have an app, like they have several YouTube videos, very easy to do, like just focus on your heart and then kind of just be in the relaxed phase. So that's one of the very easy, things that people can do. So that's one of those things. Then, their Insight Timer is another one, which is a great app that a lot of my folks like it. Very interactive and a lot of things that they can play around with doing it. So I think those are the good ones that, I like, and I recommend all of my clients to using it.
That's great.
What are some of the resources you send people to when they're, if they think they might, aside from your book and your website, which we're going to tell people, what are some of the other resources you recommend people look into to figure out where they lie and what might be wrong with them?
Right. So actually, interestingly, again, on my website, I had made this quiz, like a thyroid quiz, which again, like hits on all these 5 root causes that we spoke about. So through like a series of questions, people can actually get a good sense of which trigger might be their issue. So that's one thing that, a lot of people I say, but again, it's free, doesn't cost any money, will give you like all these different categories where it will give you an idea of where you're lying. But other good resources, even for toxins, there is ewg.org. Wonderful research. So, they have an app, that site is wonderful. if you want to live toxin free, that's the website that should be like on your bookmark, like, or like every laptop or every computer. Because you can look up your products, you can choose better products, you can scan things, it'll tell you like what is good, what is not. If you're on a budget, you don't want to kind of eat like, you cannot buy all organic, it'll give you the dirty dozen and everything. So that's a one basically like website all of my clients like I refer out to and kind of help them look out to, and it gives good resources.
Perfect. So where can people find you and your book?
So I'm on social media. People can find me on Instagram. I have a YouTube channel that they can find into. So my website is anshulguptamd.com, which has tons of information. I have an active blog. I write I like to write. So I have a lot of blog posts written, which is research based. And then, I have a YouTube channel again with the name of Anshul Gupta MD. So they can find me over there. In my new book, Reversing Hashimoto's, obviously we talk in detail about the diet, so they can also know a much more detailed version of it. But my website also has information. I have a YouTube video, actually, a couple of YouTube videos about the diet. So for the people with Hashimoto's, I want to get this message across to them that there is hope for them to get better. Don't let anybody tell you that you have to suffer and you have to live this life, which is limited by Hashimoto's. You can do much better. Your life and quality of life can be much more better. So look for answers and you will get it. Okay. Do not settle for a life that you do not enjoy.
That's an amazing
That's really
message.
Powerful.
Thank you for
Thank you,
that.
Dr. Gupta. You are listening to Dr. Anshul Gupta. We're talking about reversing Hashimoto's disease. And this is another episode of Live Like You Matter.
Thank you so much for having me on the show.
Inspire and empower someone else by leaving a 5-star review.
So they can transform their lives too.